There are two ways that a heart condition can be determined with the METS test. You can do an exercise stress test where you're actually going on a treadmill and they are testing how your heart produces and the symptoms that are displayed when you are actively on a treadmill doing the examination, and they will give you a score between 1 and 10, 1 being the lowest, 10 being the highest for the METS test. And that's how you are rated for your heart condition. The METS test, a lot of times, if you have a history of open heart surgery, if you had a heart attack, it really depends on your provider or the CMP exam, whether they feel like the actual exercise stress test is appropriate for your health. Because if you already have a heart muscle that has been weakened, and the stress test could potentially worsen that or create a dire situation where it could create complications for you and you physically can't do that test. The majority of the tests that I see in CMP examinations, they're not going to do an exercise stress test. They're going to see if you have one in your medical records and they'll pull the METS based off of that. Or more likely, they're going to do an interview-based METS test, which basically means they're going to ask you what kind of symptoms that you have with your heart condition. Do you experience chest pain, shortness of breath, fatigue, any episodes of lightheadedness, whether you have episodes of syncope, which is passing out? They will take those symptoms, and based off of the answers that you give, they will provide a METS evaluation. So for each evaluation, they match up the symptoms that you're experiencing to activities you can do. For example, 7 to 10 METS is obviously the highest. You're not really having a lot of symptoms. You're able to, let's say, bike ride, jog, briskly walk, climbing stairs quickly, etc. That's what they say for 7 to 10 METS. You're not really having a lot of issues. However, if you are in the 7 to 10 METS range and you do take medication for your heart condition, then you're automatically going to get at least a 10% rating. The next is 5 to 7 METS, which is activities as you can walk up a flight of stairs, but you have some short of breath, but you're able to do it. The other examples they give is mowing the lawn, but with a push mower, which I think is pretty physically exerting, or heavy yard work like digging in the yard, things like that. If you're able to do those kind of things without symptoms, then that's the level that they're going to give you, which is the equivalent of a 30% rating. The next is 3 to 5 METS, which has been consistent with light yard work, maybe just weeding, mowing the lawn on a power mower, so you're riding it rather than pushing it, and brisk walking. If you're experiencing symptoms where you're walking, you're getting really short of breath, or you're experiencing chest pain, fatigue, etc., you're going to get 3 to 5 METS, which is the 60% rating. A lot of the veterans that I have worked with, that's when you're really starting to actually have symptoms that are affecting your daily activities and such. And then 1 to 3 METS is you're consistently having symptoms. If you're getting dressed, you're short of breath. If you're taking a shower, you're getting fatigued. You have to sit down to able to shower. Slow walking for a block or two, you're getting short of breath, you're getting fatigued. Then that is the equivalent to a 100% rating. It used to be that the rating criteria would include the left ventricular ejection fraction, and you could get a rating based off of your ejection fraction or your stress test or METS, but they got rid of the ejection fraction. However, sometimes the examiners will still look at the ejection fraction and say, well, they don't really have a level that is low enough to be experiencing symptoms, which isn't true. How are they supposed to know? If you have an ejection fraction that's 50 or higher, which is probably most people, unless you have a pretty severe heart condition, then that is the equivalent of not having symptoms. But I think that they took that away because that is not an accurate representation of the symptoms that you're experiencing, that you would experience during an exercise stress test, or that you're experiencing in your daily living. So to me, the interview-based METS test, it's subjective, but also it gives a better picture of how the heart condition and how the symptoms associated with it are affecting your daily living. So the METS test to me is the most important part of a C&P examination. With that, like I said, they're probably going to do the interview base. So it's extremely important that you are honest with the symptoms that you're experiencing and express the extent of those symptoms to your examiner. Sometimes they're not going to ask the right questions and they're just going to say, do you have chest pain, shortness of breath, fatigue? But you need to be the one to advocate for yourself and give more details and say, no, I don't have chest pain, but when I do have it, extremely limiting, I have nitroglycerin or I have a prescription for something that I have to use. It happens this often, etc. Shortness of breath. I can barely go up one flight of stairs without getting short of breath. I can barely walk to my mailbox without getting short of breath. Fatigue. I'm always tired. I have to take naps throughout the day because I can't get through my daily activities without being extremely fatigued. So it's important that you express the symptoms that you are experiencing and how they affect you in your daily living in order to get an appropriate rating for your heart condition.
Hey, Nate here, Hill and Ponton's video guy. The video you just watched is expanded on further in this one right here. Learn something more, increase your rating. As Matt always says, knowledge is power. So go ahead,